let there become light. There was light. I prophesy over every dry bones. Hear the voice of your maker. I stand as an authority beside Jesus, and I declare, dry bones, come back to life. Dry bones, come back to life. Dry bones, dry bones, come back to dry bones, come back to life. Dry bones, come back to life. In the name of Jesus, come back to life. Dry bones, dry ayah. Assemble kopala, erobility, palasepaya, enebele kopaya naba. Open your mouth and blast in tongues. We are now in the company of angels. We are now in the company of angels. Elebele kopalia. Lift up your hands for you gates, and be lifted up, you everlasting doors. That the ayaya bala telepero, ebele kopara talapa. If you are wondering what I'm doing, I'm giving angels command. Bless the Lord, you his angels, who excel in strength, doing the bidding of the Holy Ghost. I declare, wherever you have found yourself, whatever you call it a valley, I declare, let the valley be exalted, let the mountains be leveled. In this hall, if you are sick in your body, lay your hands on yourself. I curse sickness to your root. I curse cancer. I see a lady in the realm of the spirit trusting God for the fruit of the womb. I declare, Ephata, Ephata, be open, Ephata.
I know who I am, 'cause I know who you are. The cross of salvation was only the start. Now I am chosen, free and forgiven. I have a future, and it's worth the living. 'Cause I wasn't made to be tended in a grave. I was called by name, born and raised back to life again. I was made for more. Why would I make a bed in my shame when a fountain of grace is running my way? I know I am yours, and I was made for more. I know who I am, 'cause I know who you are. The cross of salvation was only the start. Now I am chosen, free and forgiven. back to life again. I was made for more. Come on, sing it over yourself. Oh, so why would I bear in my shame when a fountain of grace is running my way? I know I am yours. I was made for more.
Hello, everyone. Welcome to today's episode. We're excited again on another episode that will transform lives, that will touch lives. Once again, good evening. My name is Ladi Stephen, and I'm the co-convener of the Breathe platform. Thank you for joining us today on Zoom and on YouTube. Today we'll be continuing our series that we started last week, and we're so excited to have a very experienced medical practitioner with us today that will do justice to the topic. We will give 1 minute while others are trying to join us, and then we'll just start because of our time. The time is never enough. Please, if you're on the call already, please feel free to put where you're joining us from. Say hi, just say something. Thank you. 1 more minute and then we'll just start. Okay, we'll just dive straight in. And today, like I said, we're so excited to have Dr. Stella, the beautiful Dr. Stella, with us this evening. Dr. Stella, as you can see on your screen, Dr. Mrs. Stella Filani is a distinguished consultant, obstetrician, obstetrician and gynecologist with over 2 decades of medical experience. She is a graduate of the University of Ilorin College of Medicine, where she has devoted the last 22 years to advancing women's health with compassion, clinical excellence, and a deep commitment to healing. Dr. Filani is subspecialized in reproductive endocrinology and infertility, with advanced training from renowned institutions across the globe. She has completed a fellowship in minimal access surgery at the World Laparoscopy Hospital in New Delhi, India, and received further training in clinical and reproductive endocrinology in Bangalore in India. She has honed her expertise in assisted reproductive technologies in Italy. In addition to her clinical achievements, Dr. Filani is the medical director of Healing Wings Hospital, a thriving private healthcare facility in Ilorin, Kwara State in Nigeria, where she leads a team of dedicated professionals who are providing quality patient-centered care to women and families. Beyond her medical calling, Dr. Stella is a woman of deep faith and purpose. A passionate worship leader and songwriter, she has touched countless lives through her music ministry, led by the inspiration and guidance of the Holy Spirit. Her passion for souls and her devotion to God underpin everything she does, whether in the clinic, at the church, or in the community. She is a seasoned marriage counselor as well, bringing wisdom and empathy into her interactions with couples and families. Dr. Stella is happily married to her beloved husband, Engineer Tolulope Benji Filani, and together they are blessed with 2 beautiful children. Dr. Stella Twin Filani exemplifies a life of service professionally, spiritually, and personally. Her story continues to inspire many around the world. This is an amazing resume. If you're on the call, please help us welcome Dr. Stella with emojis, with hand claps, as we welcome Dr. Stella from onto the stage. Dr. Stella, we need you to come on video now. Yes. Good evening, ma'am.
Good evening, Ma. Good evening,
So
everybody.
beautiful to see you.
I'm happy to be here.
Thank you so
Thank you
much.
for
Thank you
having
so much for, let me stop sharing so that we can see you very well. Yes. Hope you had a beautiful day.
Yes. Stressful as usual, but thank God I'm here now.
Thank you. Thank you for doing this. I'm trying to, let me move you into yes. Thank you so much for doing this. There are so many people who have been expectant to learn about this, and because currently we're streaming from Angola, we've had our Portuguese community also wanting to do this, but we could not find a way to do live transcribing. So we hope that we'll be able to have the YouTube version transcribed. So I have read a long resume. Please, do you want to tell us about yourself and your experience and practice with fertility medicine? Over to
Okay.
you.
I think you've done a very beautiful job with the resume, and there is I'm Dr. Stella, like you rightly said. I graduated from University of Ilorin, and since I graduated and subspecialized into infertility, it has really been a tremendous experience for me, having to interact with couples with infertility, holding their hands and giving treatment. I would say that infertility is something that we know in our society carries a lot of emotional and the strain on the relationship is enormous.
Yeah.
So that's basically what I've been doing most of the time, because aside the usual work I do as a gynecologist, the greater part of my work has to do with management of infertility.
Wow.
So, and I'm really grateful to God who has given me the opportunity to contribute to the lives of many, holding their hands, being there, and being there to also rejoice and celebrate. We have babies after the long journey of the pain and the hope. When will it happen? So when it
Mm.
finally happens, it's always something that, finished. So
Yeah. Yeah. Wow, that's such a beautiful story. And thank you for all that you do to put smiles and to wipe tears, because like you said, this can be a very difficult journey.
yeah,
One of the things I find is there's just many ways that we define in our, sometimes based on our experiences, we define infertility. And sometimes people define infertility based on what they have heard others say. I'll
yeah.
just like you to help us from your medical perspective. What is infertility and what are some of the common causes of infertility
Okay,
that you have seen?
okay. So I will try to be as simple as possible.
Yeah.
Infertility is the inability of a couple to achieve pregnancy after a 1 full year of regular, unprotected, orgasmic intercourse. This is very important to, especially in our society where we have same-sex marriages, that it must be orgasmic between the husband and wife, or male and female, who are trying to achieve pregnancy. So then we also have like a caveat to that, that when a couple is above 35 years, we do not wait for 1 full year. 6 months actually is enough for us to say a couple 35 years and above that has not been able to achieve pregnancy, to say they have infertility. Then there is also another caveat, which is that some people have some conditions that they already detected even before marriage, maybe hormonal imbalance, sperm abnormalities. And it's very necessary to know that for such a couple, they can start the journey of finding solution to the problem of infertility from the moment they get married. It wouldn't be wise to know that a man who has erectile dysfunction is waiting for a full year to begin
Mm.
to seek medical help, or someone who has huge uterine fibroids to just keep quiet. These are very, very cardinal issues that need to be addressed immediately. So, and then when we look at some of the common causes of infertility, it can be related to the man, to the woman, or both.
Mm.
And then we also have a cliche of unexplained infertility, in which both the man and the woman are healthy concerning their reproductive organs and even tests, yet they cannot get pregnant. So
Mm.
for the female, the common causes of infertility includes hormonal imbalance. This regular polycystic ovarian syndrome is quite common now. We have people that have a hyperprolactinemia. We have people with very low estrogen, low progesterone, and all these cumulatively could affect the menstrual cycle and ultimately conception. Then we have some cases of endometriosis. We are beginning to see a large chunk of people being diagnosed now with endometriosis, adenomyosis, especially in sub-Saharan Africa. Unlike in other climes, Europe, the whites have more of endometriosis, but we are beginning to see a large chunk of many of our women having endometriosis, which is the abnormal presence of endometrial glands and stroma in areas other than the endometrial lining where they ought to be. So, and that tends to cause a lot of inflammatory process, and ultimately it culminates into infertility. We have uterine fibroids, polyps, adenomyomas. We have uterine abnormalities in form of shape. We have Asherman syndrome, which is adhesions within the endometrial lining or even in the cervical portion that tends to affect the migration of sperm or eggs, and then also affectation of proper implantation when it ought to occur. Then for some women, we also have thyroid dysfunction. People with hyperthyroidism could also have infertility. Then we have for the male sperm abnormalities, oligospermia, which is low sperm count, azoospermia, which is no sperm. That means the man ejaculates and it's just the seminal fluid without spermatozoa. And we know without the seed in the sperm, which is in the seminal fluid, it will just be every month coming in and out without the product of the baby, which should actually happen. Then for a large chunk of men now have what we call varicose, which is enlargement of the veins that, the vessels that go to the testes. And this tends to increase heat in these areas, affecting sperm production. So we are beginning to see a large chunk of men with varicose, and we have people with even erectile dysfunction. We have people who have medical conditions like diabetes, ultimately affecting fertility, maybe causing subfertility, not really outright infertility. Then we have those who have infection, sexually transmissible infections like chlamydia, gonorrhea, syphilis, and all this, causing tubal blockage for the woman. And then also, it could also affect the man by causing some urethral stricture. And this ultimately affects the ability to reproduce. So, and we have obesity, we have affectation of both the male and the female by some genetic conditions, because we have found out some people have very important genetic conditions that affect infertility even right from childhood. People with these conditions, because of our audience, I think it's just important to know that there are some genetic conditions, chromosomal abnormalities, and other things that could affect infertility.
Wow. Thank you so much. This is a lot of possible causative factors you have mentioned. I hear a lot about the lifestyle, lifestyle factors that can impact people. I hear a
Yeah.
lot about like the genetic factors, which you just mentioned, and a lot, even when you go to touch the hormonal causative factors, we can see some of the mental health and the emotional pressures also showing up, and age, that when people are aging and everything. Oh, there's a lot to unpack in what you have said. I want to pitch a little into one of the lifestyle factors that you mentioned, especially when you dove in from the definition of infertility, and to ask you a question based on those lifestyle factors and the definition. How do couples who stay apart, for instance, in this season of jackbarring, wife is in Australia, husband, husband, husband is in Senegal. How does that affect the fertility? How does it contribute to infertility in couples? Because people are moving for, greener
Yes,
pastures. So
for
there are
greener
very
pasture.
legitimate reasons that
Yeah.
people are moving. But when I'm hearing you, I'm wondering, how does this affect, contribute to infertility from your experience?
When couples stay apart, yeah, for very germane and cardinal reasons of better remuneration, better life, the consequence of that, especially for a couple that does not have
Yes.
a child yet,
Yes.
one needs to balance up the whole equation. Because monthly, there is something we call fecundity rate or ratio. And for a couple who the wife you ovulate and your husband is not around during the fertile period of ovulation, that means that month is gone. Because for a lady, the egg can survive for 24 to, let's say, 36 hours at times in a whole 30 or 31 day calendar month. So during that period, we expect that a couple who wants to get pregnant should have sex regularly, at least every alternate day, even if you can't have sex every day. So if the husband is not around or is the wife that has jackpot, so that means we have a window or another chance that was created for conception to happen left vacant without that opportunity being adequately utilized. So ultimately, if that happens for most of the months in a year, we see that that is also adding to the number of years or months we are counting of not being able to have the baby. So that's one of the things that we must look at with the Jackpot syndrome, that it's better either the family moves together, that's husband and wife move together, or if one of the couples will have to first move, then there must be a plan to ensure that the second person moves as soon as possible, so that we have a balanced family. Because what ultimately happens is that if care is not taken, you have people who now go abroad, and then they now tend to be distracted because they are seeing new people there if the spouse is not with them. And then they may even begin to have families there. And then there's somebody waiting back at home, hoping that. So it's almost like a circle. Before you know what's happening, this person doesn't come home regularly as he ought to be, as he used to before. So I think it's something that we should plan well before taking the step to relocate for greener pastures.
Especially
Issue
like
of fertility.
for couples who are seeking for children, seeking to have children.
Yes.
Really, how soon should a couple start seeking help for infertility? And how do couples, I think more how do couples recognize who is the right specialist to seek help from? Because sometimes we hear people say, but I went to the doctor for many years. And then, so how does a couple recognize who to seek help from within the medical profession?
Okay. Thank you so much for this question. The truth of the matter is that we have a lot of couples who visit, maybe just general practitioners, people who are not, even some go to pharmacy stores and they tell you that we just told them we need drugs for fertility to enhance our fertility potential. It's better to seek the specialist, that is the gynecologist, and then for the man, the urologist. As soon as a diagnosis of infertility is made, that means without mixing the reality with emotions and denial. If a couple has been having sex regularly, unprotected orgasmic sex for 6 months, 12 months.
Help us, please mute your mics. Thank you. Those who are just on their way home. Thank you. Yes. Thank you.
If a couple has been trying to conceive and after 6 months or 12 months, whether they are 35 or less, respectively, they should know that the next port of call is to seek medical help from the specialist, which is the gynecologist. At times I have couples, 15 good years. I was opportune to attend to a couple some weeks back who, after 15 years of marriage with no child, found themselves seeking the right person at 15 years. I felt like crying. Why? Because at almost 50, both husband and wife almost 50, and now you are coming and it's like, please help us, whatever you can do for us. And the big question was, but what have you been doing? 15 good years. And they were saying, we'll go, they say, do scan, do this, do that. So, there is more to infertility than doing ultrasound scans. There are a lot of factors, male factor. We're getting to do hormone profile for them for the very first time. 15 good years of marriage. So that wouldn't happen if they had seen a gynecologist. So I think this is also like an advocacy and also health education for couples to know that don't just go to a place and say, because this is a doctor. There are different departments and subspecialties in medicine, and everybody is an expert in his or her field, where you actually go for more training and then you know the nitty-gritty of the job. And that way we're able to provide solution early to couples instead of time being wasted and then trying to now make things right when age is no longer favorable for whether the male or for the female. So the urologists are better in handling male factor infertility like oligospermia, azoospermia, and the likes, even though most times we collaborate as gynecologists with the urologist Even there are some times you have to regularly send the results as a gynecologist to the urologist. If there is need for varicocele surgery, the urologist is the right person to operate. So I think we must always give kudos to whom it belongs to, because
Yes.
we achieve better when people come to handle areas where they are professionals and very good
Mm,
at, and the patient benefits more at the
yes.
end of the day. Yeah.
Yes, I totally agree with you. This is an advocacy. Seek help from the right source, because
Yes.
without going to the right place, you may just be, and your help may just be around the corner, but we
Yeah.
don't have
Yeah.
to wait for 15 years to be able to get
Yes.
the help.
Yes.
What, in your experience, are the most effective treatment options that are available, and are they safe? So how safe are these treatment options? Because we also find that part of the reason why people are afraid, like you said, to hear the truth, then you
Yeah.
start living in denial, or you're afraid that if you find out, they're going to ask for some invasive surgery or something.
Yeah.
So, like, what are the available treatment options, and how safe are they? And what side
Okay.
effects should we be
Okay.
aware of?
Okay. Okay. Another very important question you are putting up here. Like for a woman that has fibroids, is always something that occurs regularly.
Mm,
After diagnosing you have fibroids and maybe there are multiple, and for those that are even staying where the baby is supposed to implant, very close to the endometrial cavity or even within, people say, is there no tablet to use? Most people do not want surgery.
yes.
People do not want, yes, people do not want surgical excision of the fibroids, which is mammectomy. And at times, some people will go into denial. Some people will say it's not my portion, only to come back 5, 10 years after and say, Doctor, that fibroid, come and remove, because I have not been able to conceive yet. So surgical procedures are safe in the right hands. By the grace
Mm,
of God, God gave the wisdom for interventions to man. The Bible says the heavens belong to God. The earth He has given to men
yes.
to occupy,
Amen. Amen.
and He gave the wisdom to do many of the interventions, surgery, minimal assisted surgeries, even assisted reproductive technology, whatever options are there in the right hand. I think it's the emphasis must be that those who are skilled
Mm,
and have learned to administer this care, doing no harm to our patients, must be the ones to handle the management of these cases. So if there is varicocelectomy, which is a surgical procedure for varicocele, should be done. If there are blocked fallopian tubes as a result of infection, before we used to do some microscopic surgeries on the fallopian tubes, but that has not been so encouraging because of the success rate is quite low. And nowadays, most people with blocked fallopian tubes opt out for IVF, which is in vitro fertilization with embryo transfer. And like those who have additions will have addisiolysis, those who have hormonal imbalance. The first
mm,
thing is to diagnose which of the hormones, because we can't just look at an individual and say, this is the hormonal imbalance you
mm,
have. Is when you do the hormone profile, you check the follicle stimulating hormone, luteinizing hormone, the prolactin, we check for the estradiol, the progesterone and the anti-Mullerian hormone for a lady. And then we look at the values comparing with what should be normal. Then when you have very high values, there are drugs that will bring it down. Where you need to pep up, there are also drugs that could be helpful, especially when you are dealing with polycystic ovarian syndrome, hyperprolactinemia. All these have affectation of fertility, that if we do not treat, the condition will continue to linger. And I've had people with polycystic ovarian syndrome who, by the grace of God, have 3, 4 children. So PCOS, whatever is the diagnosis or the reason for the infertility, has solutions. I think one of the take-home points is that we should embrace the solution, as well as know that there is light at the end of the tunnel for whatever is the problem. It is not over till it is over.
Yeah.
And we have seen even patients at 50 something years of age having babies. So if they had given up, they wouldn't have that miracle happen. At 54, 56, people are getting pregnant because they have learned to embrace solution. So the solutions available are quite safe. Like I said, it shouldn't be something we just read on the internet and say, what is the dose of this drug? An expert who with experience knows some of the drawbacks to these drugs, also knows some of the side effects and adverse effects, will be able to guide safely a couple to using medications. And then when we need to also step down those drugs in dose, they know when to do that. When we need to switch over to maybe other drugs, we know what to do part-time. So I think this is a shout out to couples that we shouldn't be afraid of interventions. We shouldn't feel that if I go under the knife, it will mean that that will be the end of that life. No, we have a lot of people who wouldn't be happy parents today if they did not succumb or approve the options that was availed to them in the first place.
Thank you so much. This is very instructive. We don't have to be afraid, even though we don't know so much. I think, like you said, go find the right person and get the right knowledge about the
Yes.
particular, the causative factor that you have been told, and also what procedure is being offered to you. And like you said, I think it is sometimes concerning to see that there's a lot of fibroid cases in sub-Saharan Africa. Is there a particular reason for that?
Fibroid cases?
Yes.
Yeah, at times we look at our climate, the food we eat, the genetic predisposition. We have huge fibroids, not just fibroids. We have huge fibroids in sub-Saharan Africa. You understand? Because at times you could have fibroids as big as a baby.
Wow.
Yes. And it's not just one, you have multiple. So at times they look at the issue of our skin color, the fact that we are blacks, that it predisposes us more to having fibroids than Caucasians, the whites. For our experience, we've also seen fibroids that are even small, that maybe because of location create a lot of symptoms too for patients. So we don't wait till fibroids are huge and big before we intervene. It's the symptoms and the complications it causes that will warrant how fast we intervene and what to do per time.
Wow. Well, let's just dive a bit into those lifestyle and for us on the platform, the mental and the emotional aspects of life that predispose people to issues, whether in their physical health or in their marriages. How does stress contribute to infertility? Stress and other
Okay.
mental health pressures, but particularly zoning in on stress.
Okay. Chronic stress is notorious for a very, very subtle yet cardinal affectation of infertility. Because, like for a lady, when a lady is stressed, it can affect her hypothalamo pituitary ovarian axis equilibrium.
That is a
And
very, very
ultimately,
powerful English in medicine.
yes, hypothalamus pituitary ovarian axis, because that's how the whole
Yeah.
it actually runs like that.
Wow.
And then when you look at stress, it could in fact, I remember then in school when at times we have exams and you are reading, staying up late at night. I don't know if you had that experience. At times you find out that you do not menstruate.
Mm,
I noticed then that I didn't see my menses. It's
very
now,
true.
after I subspecialized, I now
Yes.
understood that, oh, I think
The
it was the
link. Yes,
stress.
exactly.
The
Yeah.
fact that I
Connection.
was stressed up, I don't sleep well, I don't eat well, I tend to want to make all the available time for reading. It tends to also alter the equilibrium that should trigger that you should menstruate.
The
God is
cycle
magnanimous. The way we are created is that if the environment, the condition doesn't seem right, the body takes
will
it
be
more like a
respond.
code. It's
Yeah.
like,
Yeah.
menses is not a welcome idea now, not at this time. You understand? So stress has a lot of impact on a woman's hormonal balancing. Then it also affects even her psyche.
Mm,
Her
mm,
psyche. We know that for ovulation to occur, a woman needs as much of not just the physical hormonal balancing, but she also needs to be psychologically even calm, because there is this phobia, jitteriness, anxiety, depression, and all the likes that occur, even at times when you want to do fertility intervention. You see that sometimes a man may not be able to even perform. He knows that this is a fertile period and they've told us to meet. And lo and behold, he has erectile dysfunction at that time.
yeah.
Once
It's
that period
surprise.
passes, he's up and about again.
Yeah. Yeah.
So it's still talking about the stress, the emotional stress, the psychological stress, the the anxiety that, oh, if I don't perform now, this month will go. And that
Mm,
means we are not having it done. So stress for both the man and for the lady is a no-no, that we try as much as possible to put a lot of encouragement, a lot of hope that no, you just try to make everything look as natural as possible. That yes, we can do all things, like the Bible says, through Christ that strengthens me. And you are not, the infertility is not your identity, is not what what makes you a man or makes you a woman, especially where people tend to put a blame on one of the
Yes.
of
Yes.
of, of the
Yes.
spouse, that you are the reason why we have
Yes.
not had our miracle babies. Me, I'm fine. So the couple that the lady or the man, whosoever it is that seems to have a problem, could actually withdraw, and that ultimately also affects being able to achieve the pregnancy, because you may not be willing to go all the way anymore. Might lose all the zeal, all the enthusiasm to, yeah, let us get this thing fixed, and just recline into a shell to say, what the heck, are we the only one? I've seen people who say, I don't want to do anything again, doctor, just leave me alone. I've taken this as my own lot, but we know that this is not the plan of God for us to have no child. The ultimate will and plan of God is to have children.
Yeah.
The Bible says, no inhabitant of Zion will be called barren in the land.
Yes.
And the
Yeah.
command of God is that we be fruitful, multiply, replenishing the earth. And I know that that dream will come true for most couples by God's grace.
Amen. So for those who are on the Zoom call, you can feel free to drop your questions. For those on YouTube, I cannot see you, so I'll not be able to have your questions. But if you drop, our admin can pass on to us and we can answer. We can get the doctor to answer your question. So doctor, some of the questions we ask you now are for people who are on the call now. Some are for those who will watch the videos afterwards. One of the, I wanted to ask you, if one of the couples, yeah, somebody's just putting a question, I'll read it after this. If one of the couples is found to be, like you were talking about the blame, right? To be the responsible party why the couple isn't able to have a child. Is it best practice for you as a medical personnel to tell the couple that, how do you communicate to say you are the one to blame, and how do you support the couple to not get into the blame game? Because like you said, then that can also be the main problem why they are not able to find solution, because they go into fight mode, go into pity mode, the other person is blaming, and all those things. How do you manage that as a doctor?
Okay. I would say first and foremost, when I get to manage couples, I prefer they come together. They come together even from the very first visit. I tend to introduce the whole lot of what infertility is all about, and then what it entails and demands from both of them. That way, I also let them know an injury to one is an injury to all. Because if you have just one partner to couple with to have a baby, then if that partner has an issue, then you also have an issue.
Yes.
Because without that partner being well and treated, that means you cannot have the dream of having a baby. So that way, the support, the encouragement, the love that should come from, it's just like what the Bible says, that when that two are better than one, and they have a good reward for their labor. It says when one is down, the other will be able to lift him up. We should always see that aspect, that when one of the couple is the reason why there is infertility, maybe a man who has zoospamia, it doesn't help the lady to put up a front and air as though, I'm fine, you are the one with no sperm. How does that solve the problem? It will just continue to linger. And if
Yeah.
care is not taken, the man could also become cold towards her.
Mm.
And it could even push the man out. I've seen men who said reason why we started going out was because we weren't welcome anymore in the house. The house became so hostile, so hot, no love. The cordiality that used to bring us home is no longer there. So I try to always set this straight so that the couple now begin to synergize and work together, working it out. Okay, I've at times even seen the couple who is okay have to be the one to say, please, I've come to find out what next, what are we to do? And I'm always encouraged when I get that feedback. Unlike, you better go to the hospital, you are the one that has the problem. It's better when both can come together and make it work. And I believe that we get better results when we have that platform set, even from the onset. And then when results come in, out of respect for the person, if it's the lady that the result is coming out, like if I ask a lady to go and do hysterosalpingogram to check whether she has blocked fallopian tubes or not, and it comes out that she has bilateral, that means both fallopian tubes are blocked. It's not a good news, especially for a lady. Even I've seen ladies who married as virgins have blocked fallopian tubes just out of investigation. And then it was when they cast their mind back to when they were maybe in secondary school. Oh, I had this very bad infection. I did not take it seriously. And then, unfortunately, maybe it was a virulent organism that blocked the tubes. So, how do you now put forward that kind of a result to a couple? First and foremost, this is the report. I make sure that the lady will be there, not just the man. Because if you hand such result to the man, he would go back, he might put that information to her in a way that could even break her down more. So the best thing is to, with love, with that understanding, deep compassion. And then I say that when you are handling infertility, you must empathize. It's not just sympathy. Put yourself as though I am in this person's shoe. And if I was the one, how would I want this information to be handed over to me? So we put a human face, not just doing this job. One thing I found out that as a doctor, we need to put a human face of love. This could be myself, this could be my mother, this could be my sister, this could be my in-law. And how would I treat them? Or how would I want to be treated? That should be what I should also hand on to my patients. So it takes a lot of, I've had to cry at times with patients. I've had to pray, holding hands with my patients, for them to know you are not alone in this. That even though you see me here, even at times I've shared my own pain with patients. I remember when I had some miscarriages. So when I see patients have miscarriage, and it's like, doctor, you don't understand. I say, I've been there too. I've suffered loss. I know what it is. And that tends to say, wow, you mean you went through this too? So how? Even some now get like a springboard. Yeah. To now lift on and just like, wow. So if you could navigate and make a success of it, then I know by God's grace, I would also be able to break through and have a success on mine too.
Wow.
So that's, we could go on and on, but
I'm
basically,
telling you.
yeah.
the time just keeps flying by, and we have so many
Yeah.
questions. We have received some questions online,
Okay.
and we still have other questions, but I think I'll just take some of the questions from online. One of
Okay.
the
Okay.
questions is, when, as a medical doctor what is the number one test that you recommend when that you first recommend, or that you would recommend when you meet couples that have been trying for the recommended period? And the second one is, what is the success rate of IVF treatment options? And the third
Okay.
one is, because in our introduction, I introduced you as having a medical facility where you operate from. The question is, do you do virtual consultation? So 3 questions for you.
Okay. Okay. Thank you so much. So I would say there's no one test to do, because when you have to handle infertility, you need to address the hormonal aspect. So hormone profile should be done. You need to handle the semen. So seminal fluid analysis and culture should be done. You need to determine whether the tubes are patent. So hysterosalpingography should be done. Then we also have to rule out sexually transmissible infections. So I do endocervical swab MCS or the high vaginal swab MCS to determine if we have any infection that needs to be treated. So I've already mentioned 4 tests. Yeah, there is no way, even looking at a lady, she just comes, oh, doctor, I've been trying for 2 years to conceive. I've not even mentioned ultrasound scan, because abdominopelvic ultrasound scan must be done. That's the only way we'll be able to know if we have ovarian cysts, if we have uterine fibroids, if we have maybe some telltale signs of endometriosis and accumulation of even some of those fluid in abnormal areas. So there is no one test to be done. The tests are, it must be holistic, because if a patient is okay hormone profile wise, what if her fallopian tubes are blocked? She wants to get pregnant. And if I just concentrate on the man and say, okay, go and do seminal fluid analysis, and it comes out telling me there is oligospermia, I may have to tell the patient, go and do a scrotal Doppler ultrasound scan for us to rule out whether you have varicocele or not. Even for some patients that have azoospermia, we have to do some ductal studies to find out whether some of the tubes are blocked that is carrying the sperm into the urethra. So there are, at times when you start the investigation panel or the process, one result may lead you to say, I need to get more facts. What is causing this? At times, when we have done all the necessary tests, we now have to even say, go and do a thyroid function test, because we know that for some patients who have hyperthyroidism, they could also have affectation of fertility. So there is no one test fit all. You need to individualize care for each patient. And then that takes me to the next question that says the success rate of IVF. Globally, about 30 to 35%. Some people say 25% is the success rate for IVF. But there are centers that have as high as 70 to 80% success rate, depending on the high patient selection. And then when you do assisted reproductive techniques, the quality of care, the quality of equipment, the quality of uh, experts carrying out this intervention also impacts the success you get. And then most times, centers that have very high success rates, they also do their patient selection, which they won't tell you. There are
They
some
will not
patients,
say,
maybe
yeah.
if a patient is maybe like 50 something, they may not really encourage
Yeah.
them. You
Mm.
understand? Because they know that for such a patient, you may have to try more and more. And they may not succeed the first time. Ultimately, they would, because we've had cases that succeed even at that age. But then we know that a woman who is already menopausal, who has stopped menstruating, whose hormones are already FSH so high, you have a lot to first balance. You need to first balance the hormones. At times, you need to do adisolysis for the menses to come back. And then you have uh, hormone replacement therapy before you can even say, yes, let us go ahead and do IVF. So all this affects the percentage of success that we talk about. But if all things being equal, the success rate could be as high as 50%, 70%, depending on centers and what are the things that they put into perspective before admitting patients for IVF intervention. Then, do I do virtual consultation? I have a lot of patients that I don't even know who may
Okay.
be based on referral all over the globe.
Okay.
All over the globe. I remember the day I was in a particular gathering and somebody just mentioned Dr. Filani, and I saw a lady just rush in and hug me, and she was almost pecking me. I was like, wow, I don't know you. And she was like, you don't know me, doctor. It's true, but I've been looking for your number. You helped me. I have twins now.
Oh,
Somebody referred you to me. You were always consulting with me online.
oh,
I do that regularly.
okay. That's
I
amazing.
do that. It's a thing of joy for me to be able to at least put a smile on somebody's face. Whatever I can do, I will do, as
Oh,
long as God gives me strength. And there are a lot of people that have been able to help in that aspect, especially aspects of infertility.
amazing. So, for we are really struggling with time.
Yeah.
So, for those who would like to reach out to Dr. Stella, please put our links so you can reach out to us and we will connect you to Dr. Stella because this is on social media. We cannot put our contacts, but when you get in touch with us, we will connect you. There's still another question as we begin to try to wrap up. Why is
Okay.
Ivy why is infertility treatment so expensive? Because it takes a toll on the finances,
Yeah.
on every aspect of the lives
Yeah.
of the couples. And I'll
Yeah.
just add one more question as we begin to to wind up as a doctor. What are some of the most challenging cases that you have found, that you have encountered? And have you seen miracles to give hope to somebody who is listening or somebody who will listen?
Thank you so much. Infertility treatment is expensive, and in fact, even for the whites, is because the government has subsidized infertility treatment for them. And for couples that have to pay out of pocket for this, we know that The drugs, is it the drugs we want to talk about? Whenever, especially if you have to go doing IVF, injections are in thousands of naira. And you are not just taking one, you are taking it on a daily basis. A lot of money goes into it. A lot of money goes into getting equipment for the infertility intervention. So, in a country like ours, where many people have to pay out of pocket, even for the insurance, I do not think it has infertility as one of the things it covers, because
It's very
it's
well.
huge.
Yeah.
It's going
So
to be
especially,
huge.
yeah.
Yeah. So there's nothing we can do about it, except maybe if the government eventually looks into it, to have maybe a subsidy for infertility intervention. And then there's this low cost IVF that maybe for couples that the reason for their IVF is not so bad. The hormones could easily respond. You could get eggs. The low cost IVF may suffice, but most of the people from experience, the low cost IVF do not really do the job. So you have to go all the way to stimulating, and then even there are some cycles you may need to cancel, because if despite stimulating the ovaries are not coming up with eggs, you may need to cancel and then maybe get donor eggs for the couple. So whichever way we look at it, the donors are not free. They also expect to be paid, and they are also going to be stimulated with drugs. The IVF drugs are quite expensive, very expensive. So I think that's why basically a lot of couples is still a part of my prayer that many more couples will be able to access the availability of IVF. At least I remember a couple was saying, let me even try. Let me try. If it fails, then this part of my heart will feel that at least I gave it a
Give
try.
it your best. Yeah.
Yeah, I did not just say the pregnancy did not come. And there are a lot of couples out there who would rather want to try, but
Yeah.
finance
Depends on.
handicaps that desire being actualized. Then the other question that talks about some challenging cases. Yes, I've had a couple of challenging cases. I remember at times when you have to manage young ladies who are just 20 something, and you are already picking that the ovaries have packed up like a premature ovarian failure. It's quite challenging. And that's even quite different from those who have genetic abnormalities that you cannot really even do much for them other than, okay, let us even provide diagnosis and then see how they can have life, how will I call it, be able to have a living, not just existing. Some people do not have vagina. Some you have to do vaginoplasty, create a vagina, just for them to have a sense of, I'm a lady, I have opportunity to copulate. You already know it's a blind ending vagina. Then, some other challenging cases are like for the quite elderly, you know. Yeah, it could really break you down when you see someone who says, I see myself almost 60 and I don't have a biological child of my own. And for such patients, We prefer the alternatives, like you could get a surrogate mother, you could get a child adopted that you could take care as your own. And those are options that are available also there, but quite expensive too. Because to get a surrogate mother now, you have to pay a lot for centers that do it. Yeah, I've seen miracles. Miracles happen, and they are still happening. I've seen God do what at times He alone as God can only do. I've
After
seen that happen.
the medical
Yes, that
people have
defies
given
medical. Yes,
explanation.
yes. I remember there was a time I had a lady I operated, both ovaries, huge with blood, and you know, when we went in, the ultrasound was just saying ovarian cyst. But when we got in, it was something else. And we just had to after evacuating the blood and everything, we're almost tempted to say, should we remove the ovaries? Well, if we do, that means we've knocked out her fertility potential. She doesn't have ovaries, except she does IVF, and then with a lot of support. So putting the little ovarian tissue together, sewing it, I just did that. And I remember the husband coming to meet me that, will my wife ever have a baby? He looked at me straight in the eyes and said, just tell me the truth, doctor. Because I saw it. We had to call him in. And I told him, I said, I'm not God. I've done what I can do as a gynecologist. Let God do what He alone as God can do. As I'm talking now, this lady has 2 children. She had a miscarriage. She would have had 3.
Wow.
So
Praise
when
God.
a day she came and said, Doctor, I'm feeling sick. In fact, we're not thinking of pregnancy first. It was after, it's not malaria, it's not this. Let's do PT. It came out positive, and we're like, wow, this is a miracle. This is a miracle. And not too long after that, another baby.
Wow.
So I've seen miracles happen. I have patients who have been told they had blocked tubes just a month or 2 after diagnosis of blocked fallopian tubes. They came in pregnant. And it's like, how did it
How do
happen?
we explain?
I can't explain. Nobody can. So I've learned that we are I think one thing that is very important, that nobody can play God but God alone. And it's not over till God says it
Till
is.
God says yes. Yes.
Yes, He opens doors that no one can shut, and He shuts doors at times that no one can open. And when He opens doors, some of these doors, by all medical explanation, you can't explain how it happened. It's like, but we got the results, we got this, but it's not adding up. But what
It
matters is
doesn't
that
happen.
she's pregnant. She's pregnant. So those are areas that always make me still bow before God. Like always, that God, I just thank you because you are God and you are the one ruling in the affairs of
Yes.
men.
Yes. 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 He's the doctor of doctors.
He's the doctor of doctors, the
Thank you
balm in
so,
Gilead.
thank you so much, Dr. Filani. We are
You're
so
welcome.
grateful for this 1 hour slightly plus that you have spent with us. You heard the doctor herself saying there is still hope, irrespective of the diagnosis that you have, irrespective of what we have been told, irrespective of the fears that you have. She said to us, it's not over until God says it is over. There's hope. There's been tons. One of the comments that somebody put earlier is like, this is so informative. So you don't have to allow infertility to define you. Dr. Filani said that there is hope, there is solution, there is help, and we don't have to resign. There's something that we can do about it. God has put the wisdom, has put the knowledge, has put the skills in people like Dr. Filani who are out there to help couples. And don't let stress pull you into deeper and deeper into infertility. If you'd like to know more, we did one series on stress last year. If you check one of our videos, you'll see what to do. For those who would like to reach Dr. Filani one more time, those who are on the call or those who will be, who will watch this call subsequently, please reach out to us and we will connect you to Dr. Filani. Once again, thank you so very much, Dr. Filani. One last advice
Thank you
for
so much,
couple facing infertility before we wrap up for the night.
Yeah.
You would one last advice. One word is not possible.
Yeah. I want you to know you are not alone. And I want you to know that if you do not give up, you would surely embrace those wonderful babies. There is hope. There is great hope. And walking it together, walking the journey of infertility together is better than going separate ways. There is no point calling it quits or seeking a divorce because of infertility. If we do not give up, there is hope. That's my advice.
I was trying to share. I don't know if it is sharing. Oh, thank you so much, Dr. Filani. Now I can't find those again. Okay. Thank you so very much. There is
You're
hope.
welcome.
You do not have to close out on that marriage. This is what the doctor said to us. There is hope. You don't have to close down that marriage. You don't have to kill each other, and you don't have to run away from your partner. Together, you can find solution. Thank you, Dr. Filani. We're so grateful. We wish you a very lovely weekend. Next week, we'll be back to look at the spiritual impact, and we'll look at the spiritual angle of infertility and what else we can do. Do well to follow us. Rewatch this. Watch it if your partner was not on the call. Watch it together, and take the necessary steps, and the Lord will bless you. Once again, thank you so much, Dr. Filani. Everyone, have a lovely weekend. Bye.
Thank you so much. Yeah.